Thank you so much for people outside. Yeah, let's hurry. Good afternoon, everyone. Hope everybody's doing well. I'm by names of Albina Sydney. I'll be mastering the ceremony of today. I would like to see some faces smiling, please. Is it possible to see a smile even inside the mask? Yes. The principal of the College of Medicine, while he becoming
for mental health, but it's very special for mental health among youth. Mental Health Day, globally we are celebrating, but we decided in Rwanda, together with UNICEF and the Rwanda Biomedical Center, to focus on youth. And most importantly, is the training we are offering to youth. Youth are becoming peers, or a group of our students. Frontline. They are living with their friends, and they are there when we are busy with our work. So that is commendable. Thank you very much, UNICEF. Thank you very much, RBC, for doing. One is really important. We need to work together in a collective way so that we can achieve really quality mental health care. And the reason why we are bringing youth on board, especially from the university. Please allow me to acknowledge the presence now of our guest of honor, Dr. Yvonne, the Division Manager of Mental Health from Rwanda Biomedical Center. Dr. Yvonne, you're most welcome. what you're celebrating today together with our partners, but it's also providing mental health care to the community. And they do this, of course, with our partners. We have many partners. We have SOS, we have Rwanda Biomedical Center. They do it together as we are insisting on collective manner of doing this, holistic care. They also do short training. They follow our students when they finish here, when they're already in their own society, and provide the CPDs, the continuing professional development. But not only in Rwanda, they go beyond Rwanda and invite people from other countries in Africa to come here and get the training, the CPD. We thank you very much, Professor Vensa, and the whole team, the whole psychology or mental health team. We thank you very much. And they continue being involved in the teaching we are doing here as our main mission. So, having said that, we appreciate, because we won't manage this if we don't have the support from our leadership, the university leadership. Having said that, I would like to invite Professor Noza, and sir, thank you very much. I know you're always there to support all what we have achieved through the mental health, through the teaching I've mentioned, through the research and the community service I've mentioned. Thank you very much. And I know you are here on behalf of the Vice Chancellor, and we really appreciate. So you are welcome, sir, to give your opening remarks. Thank you.
Thank you so much, Principal of College of Medicine. I humbly request the DVC academic to please come by and give us a welcoming speech and, of course, any criteria and all. Thank you.
Afternoon, everybody. Let me start by standing by the protocol established by the principal of the College of Medicine and Health Sciences of the University of Rwanda. However, I still like to acknowledge the presence of our guest of honor, the manager of the Mental Health Division of RBC. You're welcome, madam. The UNICEF country representative, together with the delegation here present from UNICEF. That is an organization, a UN organization that we're all proud of. I also like to acknowledge representatives of the various universities, and I observe all of the other protocols. And welcome, ladies and gentlemen, to this very august occasion. Now, I am Professor Nosa Egibo. I am a professor of chemical engineering, nothing close to medicine at all. But I understand the importance of mental health and good health generally. I am here basically to represent the Vice Chancellor of the University of Rwanda, who is unavoidably absent this afternoon. He really would love to be here, but he can't be here because of other commitments. So I'm standing here for him, representing his presence. The only thing I'd like to say in addition to that is that my presence here is an indication of the importance that the university ascribes to this occasion in celebration of the World Mental Health Day. And as you all know, the theme of this particular occasion is mental health in an unequal world. And that will basically be the theme of my own very brief remarks to welcome the group here. I'd like to also mention that the University of Rwanda, through the College of Medicine and Health Sciences, have more or less been a champion in pursuing awareness, health services, specifically mental health services, creating academic programs, educational programs throughout the Republic of Rwanda. Recently, we actually also created graduate programs in mental health nursing as a specialty in recognition of the importance of mental health. A few things I want to briefly talk about relating to mental health. Why are we here? Well, you don't see occasions where we get together and celebrate problems of other organs of the body, like heart disease, for example. Somebody had high blood pressure. You don't have situations where we gather like this and say, well, let's talk about high blood pressure. There's something particular about mental health, and there's a reason, and that is the reason we're here. And what is it that is particular about mental health? For as long as all of us can think about mental health, you realize that in a society where we generally tend to discriminate against those who show symptoms of mental health, we tend to stigmatize people who have mental health. Because of that, a lot of people are unwilling to come out to report that they have mental health issues that need to be addressed. And why is that? It's very strange, because we know that the brain as an organ, probably the most complex organ in the body. And therefore, the likelihood that every now and then something goes wrong is there. And yet we don't recognize that. We don't stigmatize people who have kidney disease, for example. No, we sympathize with them. So which means we have a long way to go in terms of educating ourselves as to the importance of mental health and making our people aware that mental health is just as common, if not more so, than a lot of other health challenges and health issues. So I'm here to celebrate with all of you the World Mental Health Day, because it is that important that we continue to work towards providing services to those who are in need of mental health services, and also those who are in need of our own community help, societal help, to meet and deal with those challenges. At the University of Rwanda, our university, like many others, we have tried as much as possible to invest in all of the resources needed to support mental health. And we're very happy to congratulate our partners and those who have worked very closely with us. And the principal CMHs has mentioned some of them. RBC has been a major partner with us. UNICEF has been another major partner with us. And more importantly, our student groups and champions, as far as I'm concerned, have really been the most important. Now, mental health has been a challenge for a long time. let's now look at what had happened since COVID-19. Basically, the restrictions as a result of COVID-19 and the social, restrictions that were imposed by society in order to avoid a rapid spread of COVID has ended up creating even more incidences of mental health. People being locked at home, people now seeking solace in alcohol, in drugs, leading to serious family issues, leading to depression. All of these have more or less been exacerbated because of COVID-19. And a lot of these issues have actually affected young people significantly. As a matter of fact, I think more of the impact has been on our young people than the older people who invariably have been able to deal with the situation. So for that purpose, we do need to really recognize mental health as a major challenge in our society. And this activity is one that we should all be proud of, and we should all stand up and support and participate in. Finally, the University of Rwanda really congratulate the support we've received from the local universities, students who have gone around our various campuses, highlighting the importance and highlighting the awareness of mental health in our society, and making it known that there are services, there are areas, places you can go to solicit and seek support to deal with mental health issues. With that, I will say that as time goes on, there is hope that things will be better with some of the awareness activities that we are engaging in, what our college is doing. And I'd like to specifically also thank our Center for Mental Health here at the College of Medicine and Health Sciences. I know that people have done a yeoman's job of really getting this activity that we are here for today in place. A lot of us have worked day and night to make sure that this particular activity is successful, and just looking at the hall, you can see that there's quite a bit of interest in mental health. And I welcome all of you to this very World Mental Health Day. Wish you the best in all of today's celebrations. And please, I'd like to use this opportunity to solicit for additional partnership. The university needs partners. The Mental Health Center needs partners, needs support. Partners, whether it is contributions on a personal basis or financial contributions from major corporations, we need all the help we can get in order to move the mental health initiative to the smallest corners of this country and maybe of the region. I thank you so much. Thank you.
Thank you so much, DVC Academic. I think it deserves another hand of applause, please, for him. Me considering it and people who are here, this is a situation that is really happening here in Rwanda, because we couldn't be here if it's not really happening. It's a serious issue for us, the youth, for people who are our grandparents and all, and even for the kids that are growing nowadays because of the history of Rwanda, as you know, and because we are suffering in one way or another. Wrapping it up, he just said something very amazing, that the youth is doing something amazing. All the youth who are here, please give yourself a hand of applause, because you're really making it happen. You're asking one another what's happening. And I think it's about the love. Wrapping it up, I'm honored to welcome Dr. Darius Gishoma, who will be much more talking about the updates about the situation in Rwanda, yeah? And also the updates about the Youth Mental Health Campaign Tour and the feedbacks considered by the Association Leader Representative. Association Leader Representative. Thank you.
Thank you so much. Good afternoon. I'm very pleased to stand here to introduce or to provide broad picture about mental health in Rwanda. I'm presenting on behalf of a team working in this field, led by Dr. Yvonne Kaiteshonga, and I was very pleased to be invited also to support the adolescent mental health program initiated by UNICEF and RBC. The next slide. And I wish to talk about mental health situation in Rwanda under three pillars. First, to talk about the burden. Second, to talk about the process of delivery of mental health services in Rwanda. And lastly, we make a comment about emerging challenges and areas where we need innovative solutions. In terms of burden, we need to highlight 5 important risk factors about mental health in Rwanda. Today we are focusing on the group that is on the left of our slide, meaning the people under 30, children, adolescent, and youth. But it is impossible to talk about adolescent youth without talking about parents. The majority of parents in Rwanda have faced an important traumatic event, the genocide that occurred in Rwanda in 1994 against Tutsi, where 1 million of people have been killed, not by people who invaded the country, but by their neighbors. This situation leaves survivors traumatized, but we also have people who committed genocide. So youth we have today, what is the impact of growing up not having parents, aunts, uncles, and on the other side, what it feels to grow up knowing that the father killed maybe 10 people in the village. So the youth we have today are growing up through a family environment heavily affected by the genocide. So the genocide is one important risk factor for mental health problems in Rwanda. We see it in clinical practice, through research, and it's a factor that is going to affect mental health for a number of years. The second factor we wish to highlight, mental health problems are not only related to the genocide. There are other factors that are affecting families. We just highlight the example of intrafamilial violence. The figure right is data from the Rwanda Demographic Health Survey showing that the violence against women and men have not reduced from 40 in 2015 to 46% in 2000 with the recent Rwanda Health Demographic Survey. So it means having children growing up in family affected by instability, violence, affect the capacity to provide care to children. The third factor that we want to highlight among risk factor is that children are also facing themselves violence from family, peers, from the community. And there is a study conducted 4 years back by UNICEF, Ministry of Health, CDC, around the phenomenon of violence against children and youth. And one of the conclusion is that 1 in 10 adolescents faced sexual violence. This has an impact on the way they feel emotionally, the way they relate to others, and it's not only among adolescents, even young adults also face that phenomenon. The fourth factor we wanted to highlight among risk factors is this phenomenon of teen pregnancy that is associated to other risk factors. Rwanda Demographic Health Survey is showing that it reduced from 6.1%. It increased a bit from 2010 to 2015, from 6 to 7%, and it reduced from 7% to 5% in 2020. It's an important development, but even there's 5%, it means when we look on MOH reports, it means 19,000 girls that have been pregnant, being adolescent in 2019. So these are factors that are affecting mental health of our youth. And when you see, for instance, the figure on the right, it shows that the mental health problems are 2 times higher in adolescents facing this violence compared to those who are free from violence. The last factor we wanted to highlight among risk factors, it's chronic diseases. The prevalence of HIV is 3%, diabetes, cancer. If a child, a youth, or a family is affected by these factors, all of these contribute to affect mental health of our children, adolescent, and youth population. The results, because we have been requested to talk about the situation of mental health, the result is that we are having a high burden of mental health problems in Rwanda. 2 years back, the government of Rwanda requested to have a study about mental health, and it is the biggest study conducted about mental health in Rwanda. The Rwanda Mental Health Survey, with a sample of, the team visited about 7,000 households and interviewed nearly 20,000 of people, and it shows that the prevalence of depression is 11%, which is high, and figures are 3 to 4 times higher among genocide survivors, which makes sense. You start to have alcohol use disorder if it is 1.6% among general population. It is 4% among genocide survivors. It shows that we are also having suicidal behavior among important challenges to mental health. The broad figure is that 1 in 5 was having at least one mental health problem. And when you look about figure, it shows that women are affected more than men. And it makes sense because there are a number of risk factors affecting women than men. There is a slight increase in urban than rural. And as the WHO is always reminding that majority of mental health problems start around toward the end of childhood, adolescent, and early adulthood. That's what the Rwanda Mental Health Survey also showed, because 20% of disorders happen before 30 years. The next slide. I can't finish to talk about the importance of mental health problems without having a particular attention to children and adolescents. From the Rwanda Mental Health Survey, it appeared that 1 in 10 children had a mental health problem. The most common was depression, that was 4%. And there are people from UGHE. The UGHE University conducted a study about depression in specific subpopulation of children affected by, with HIV, and the depression goes from 4 to 14 when you have, among children having HIV. So this shows also areas where we need to focus our intervention. Now, delivery of mental health. I wish to focus on 4 settings where mental health is delivered in Rwanda. The first one is that Rwanda had made tremendous effort to build mental health infrastructure in Rwanda. We had our first mental health policy in 1995, and the first decade after the genocide, the Ministry of Health invested a lot of effort in building the capacity in different district hospitals. Today, 46 district hospitals in Rwanda have a mental health service, as it appears to that map. We are also having referral hospitals, King Faisal, CHUK, CHUB, and other specialized services that are availing service around the country. And over the last few years, the Ministry of Health with partners are also investing in availing mental health services to health centers. A few years back, I think in 2019, I was in a sector called Nyarugenge in Bugesera. We met with a pregnant woman who had mental health problems, and to move from her village to the Nyamata District Hospital, being pregnant, she had to pay 8,000 Rwandan francs using a motorbike. So it means 16,000 Rwandan francs to access mental health services. Now, the Ministry of Health have recruited psychologists, nurses in health centers. 419 health centers in Rwanda out of 510 are having a mental health service. So it means that woman will not have to go to Nyamata. She will access mental health service near her village. We looked to data available, just to give an indication. In 2019, a total of 177,000 people were followed up in these different mental health services. Among them, 10% were coming for the first time. It means it's an area where we need to also to focus about people accessing, because only 10% were accessed mental health service. And a particular attention again to under 20, only 5,700 were children and adolescents coming to seek for care. Next, please. If mental health services were to be availed only under a health system, that would be a challenge. We are having, there is a recent assessment that shown that there are about 89 civil society organizations working in the field of mental health, including organizations that are represented in this room, where people have the opportunity to get services and different type of psychosocial support. This is important because it is complementing what is happening under the health system. The third setting where people get service is through what is called in the mental health policy intersectorial program, because we are having people accessing mental health services, for instance, under the education system, the adolescent mental health program. The Ministry of Gender and Family Promotion have hired psychologists working under NCDA to support children and family. These are also source of support about mental health. The Ministry of Justice have psychologists in prisons. The Rwanda Demobilization Commission have psychologists. Minubumwe recently created have psychologists because unity and reconciliation is also part of things that build resilience. The Ministry of Youth, and we also have an interministerial committee at the level of the Prime Minister office looking at substance use. So this means that we are having service not only under the health system, NGOs and associations, but also other social ministries that are supporting people. And the last setting that is appearing is also private practice that we are starting to have in Rwanda. And also we have to commend the efforts and role played by this college, because most of people who are creating these private and public, working in these public services are trained from this college. Now, toward the end of the presentation, I want to talk about few emerging challenges and areas that probably need innovation. The first area that needs innovation, or where we have challenges, is that the Rwanda Mental Health Survey have shown that among people having mental health problems, only 21% are accessing care, which means that we have a treatment gap of about 80%. The treatment gap is even higher among a subsample of adolescents. There is a subsample of 2,800, where the access was 8.7%. So the gap is high among adolescents. It means that we need to, there are people who are underdiagnosed and untreated. Then, in terms of innovation, we need, and the RBC and partners have started to invest in school-based or adolescent mental health, where people can access service not only in hospitals, but also from schools, having school counselors, and that increased the number of adolescents screened, treated, referred, or where school counselors can offer support to parents having challenges. Another area, emerging challenge, is substance use. When you see figures from Ndera Hospital, it keeps increasing. The next one. Next, please. When you see figures from a newly created center in Huye treating addiction, you are having people using cannabis, heroin, etc. Also numbers increased. Next, please. It's not only in treatment center. When you go to community, you also find that substance use is a challenge. We had recently, this year, a study conducted under the leadership of RBC and ENABED. In 7 districts, 3,000 of youth are aged under 24, responding to questions, also having urine tests and tests confirmed through the laboratory at Isanye Huye Rehabilitation Center. And the test showed that substance use, even in the community, is a problem. The next slide. Because you are having nearly 5% of youth that from the 7 districts that were using cannabis and some using heroin. Cocaine is rare because it is a bit expensive, but it shows it's a challenge that we need to take into consideration. And what is important is that the study also looked at the association of using substance and sexual reproductive health variables. And using substance, for instance, increased the risk of having unprotected sex 3 times. So this led innovation from RBC and ENABER to say, let's develop intervention around substance use and reproductive health. Next. Another area that is an emerging challenge is the COVID. The DVC introduced the speech and talking about it, and it's reflected in figures we have. We are first having a decline in service utilization because people were not able to go to seek services, a decline of 30%. At the same time, we are having an increase of 41% about suicide attempt, which means that we need to be creative to develop services around this specific period. We are also having data from health facilities showing that gender-based violence have slightly increased during the COVID period, which is a risk factor to mental health problem. And the next slide. We are also aware that there are challenges related to intergenerational legacies, and in terms of innovation, the Rwanda Mental Health Strategic Plan over the next 5 years includes strategies around working about prevention and tackling these risk factors. Another innovation that is needed is to provide service through early childhood development service, because risk appears earlier, about investing in adolescent mental health, in school-based mental health, in providing parent support to parents, working about rehabilitation, but also reintegration of people having mental health problems, developing private practice, technology-based services, because people need, with the current context of COVID, that is an area where we need innovation. And also the strategic plan highlights the importance of having data because it informs policies and practice. That is my last slide, and the message is there are services, there are problems, mental health problems, but there are also services developed. As the theme of this year, there is hope after diagnosis of a mental health illness. Let's seek care. And my second message is that the journey continues. We are only 28 years after the genocide. A lot have been developed, and I think there are so many things that need to be developed through your innovation. I thank you so much for your kind attention.
Thank you so much, Dr. Darius Gishoma. He just said something amazing, and it reminded me of a quote that says, pain is real, but so is hope. So I think we all have the hope that it will reduce, and whatever consequences it's causing to us, the youth, to everybody who is concerned, it will get a time and get rid of it. Going through it and wrapping it up, we are about to welcome the associate leader representatives who just did a tour all over Rwanda by making the awareness of this issue of mental issues and all. And let's welcome Miss Gloria and Mr. Soter. Thank you so much. And as a reminder, people who use social medias and all that is concerned, this show is being live streamed on YouTube via University of Rwanda TV. So you can tell a friend to tell their friends so that they can at least follow this, because it's about the awareness. So I think it's a chance that even a person who is not here in this assembly can know. It's via University of Rwanda TV via YouTube. Thank you so much.
Good afternoon, everyone. My name is Soter Ndikubwimana, students from the Department of Clinical Psychology, Level 3. I am also the president of CEPSAR, Clinical Psychology Students Association of Rwanda. we spent a week in the youth mental health youth campaign that was done in the line of continuation of celebrating World Mental Health Day. It was a collaboration of Students-Led Association, SEPSA, Clinical Psychology Students Association of Rwanda, UMATA Initiative, Rwanda Village Community Promoters, COSA, Here to Share, Bullied to Hear, Global Med, Feel Better Initiative, As Against Mental Illness, Imfura Heritage Rwanda, Medisar, Rwanda Pharmaceutical Students Association, Rwanda Mental Health Nursing Students Association, and the Mental Health Journal Rwanda. It was done through the online campaign and on the physical activity. On the online, there was the willingness of the youth to contribute in mental health and have many problems just concerning and want to ask related to the mental health. I and my association I present, I'm going to talk about the journey from Kigali, Huye to Rusizi as the campus tour. It was a longer distance, as you know, from the Kigali or Huye through the Nyungwe. We visited Rusizi campus. In the Rusizi campus, it was a good session. We just were welcomed by the Rusizi staff, and we started at a time at 1 to 20. We had Ishimwe Pascaline, presenter from RBC, and she was our guest of honor. And you had Dr. Simeon Sebatukula, the representative from the Center for Mental Health. And you have other from the poem and the testimony from those associations. I don't want to take much time. The session was really good, and the students in Rusizi campus was really interested and just very concerning for knowing and acknowledging in mental health. I want just to mention some recommendation, just they give us to bring to Center for Mental Health, RBC, and the other organizations related to the mental health. Through the presentation from RBC, Ishimwe Pascaline, just as the helpline 114, they recommend the other mental health organizations just to distribute another helpline so that the people can be free to send their videos, their testimony, their question. Also, they recommend other mental health institutions to use insurance so that it can be very easy to access the mental health service. There was another recommendation started by people saying in the primary school, they say, what is the malaria? What is the malaria? They say, how to prevent malaria. So why not, from the childhood, people can access the knowledge for mental health. And they say, what is the mental health? Just they mention disorders. How can you prevent it? How can you help the someone? Because they show us that the challenge, they start to know the mental health when they are just at the older age. From the childhood, they don't know about the knowledge of the mental health. So that when they grow, what they know during the childhood, it's just like the rumors. Those are the myths. That's not really or appropriate in mental health. Just then say, umusazi gutora amashashi. No, they know it when they are at the older age. So they wish that those program or those knowledge can be put in lower level schools. Thank you very much. I would like also to thank those associations. I can say this is a starting. No, we have already started. This is a journey, have to be empowered so that we can reach on another campuses. Thank you.
By welcoming Miss Gloria, I think he just said something amazing, that it's a relentless reaching. You reach one to another. So I think it's just a journey that everybody's doing. Let me remind you that we are tuning live on YouTube. People who are entering, welcome so much. And thank you for people who just tuned in on YouTube via University of Rwanda TV. Welcoming Miss Gloria to continue to update us on their tour in Rwanda about the mental health. Thank you.
Good afternoon, everyone. My name is Umngari Gloria. I'm a clinical psychology student at the University of Rwanda. I'm in level 4. I'm also the founder and director of a student-led organization called You Matter Initiative. I was part of the team that visited the UR Nyagatare campus on the tour, and we were pleased to receive and to work with over 200 participants, and mostly students from that campus. We had 2 presentations, one on this year's theme by a representative of RBC, Mr. Nshimiyumuremyi Eric, and one presentation on basic knowledge on depression and anxiety by a member of GIRG and a clinical psychologist, Ms. Umulisa Josiane. 3 young people gave testimonies on their experiences with mental health and mental health services in Rwanda. Afterwards, we had a Q&A session. The first impression was that young people are truly thirsty for mental health related knowledge. Some of the requests were that they get assisted in creating mental health clubs on campuses. They also expressed their desire to attend more youth-focused workshops on mental health matters. Young people at Nyagatare campus acknowledged and expressed their need to know the difference between depression and sadness, for example, between personality and ADHD, and their like. As student-led associations equipped with some knowledge on mental health, were motivated definitely to organize further psychoeducation events, especially for the youth, not only young adults in universities, but also teenagers in high schools. Thank you.
Thank you so much, Miss Gloria. I think this is an amazing tour they just did, and wrapping it up. Let me remind you that this event is organized by the University of Rwanda, of course, with the Center for Mental Health and RBC UNICEF, aside students and aside youth lead organization. This is something amazing because it's coming from the top up to the all best aged people. By welcoming the panelists, let me welcome the moderators to welcome all the panelists that will be talking about the mental health. So I think it's an amazing time to really listen to people tuning in on live and people watching as the youth, because we're about to talk with the youth as us. Moderators, please.
Good afternoon, everyone. Okay, so my name is Kelly Gahunga, and I'm a second-year student at the Adventist University of Central Africa in software engineering. and I'm the founder of Us Against Mental Illness, which is a platform fighting against mental illness.
Good afternoon, everyone. My name is Agasara Anik. I'm a fourth-year medical student, and I'm the president of GlobeMed, an association here in the campus.
Okay, so right quick, we would like to welcome our panel members. We'll start by Injoge Karangwa.
As we call you, you might come forward, please. Injonge Karangwa.
Injoge. Yes, and Basilium Maeve, Dr. Jean-Pierre Ndagijimana, and Prof. Sezibera Vincent.
Let us give a round of applause as we welcome our panelists. So we are having 4 panelists today. Starting from my left, let me briefly introduce our panelists. Her name is Injoge Karangwa. She's the founder of Hamwe Festival, and she's the director of arts and culture in UGHE. She is also a global health professional and a researcher. The following is Basilia Maeva. She is a student and the founder of Here to Share. The following is Dr. Ndagijimana Jean-Pierre, and he is a PhD holder. He has started several initiatives fighting against, such as Ubu Wiheranwa Nagahinda, and he is the co-founder of Rwanda Psychology Society. The last one is Professor Sezibera Vincent. He is a University of Rwanda staff, and he's the director of Center for Mental Health.
Okay. Right quick, thank you for the round of applause. We would like to start with Injoge Karangwa. So my question is, would you tell us briefly about your work in Hamwe Festival?
Thank you for this question. Thank you for having me here in this very interesting event, an important event. So my work at Hamwe Festival, so the University of Global Health Equity that I'm working with is trying to focus on multi-disciplinary approach as we are trying to advance global health equity through education and through different type of interventions such as public engagement. And what we do with Hamwe Festival is that we have created this platform that is focused on Rwanda, but also invite international people to discuss about different type of health topic and how health can partner, how the health sector can partner with the creative sectors. So we see artists and creative as the partners to global health efforts. And with Hamwe, we started a conversation around that, how we can partner, and a lot of questions have emerged on so many topics, but one topic that was coming very, very often was mental health. So we say that if there is interest and a demand for a conversation, we are trying to be helpful and try to continue engaging and offering our platform. And that's really how we work. There's these conversations, from all those conversations, there is more questions, and then we're trying to continue and engage. So our role, how we see our role, is really to provide as much information as we can in a way that is very interactive and very engaging, shed light on projects that have used art or sometimes different things. We are, for example, last year we had a conversation about how connecting with nature, having a ballad in the forest or something like that is very beneficial to relax. So trying to share information about what we can do before alternative alternative intervention that are non-clinical to maintain mental health, actually, for well-being. Sometimes we answer those questions through our events, but sometimes also we try to engage in different ways. We created podcasts. For example, we have a podcast that talks about how music can be very, very beneficial for your mental health when you listen to it alone or when you listen to it with people, how it creates community, how it creates belonging, how it's relaxing. So that's the type of work that we're doing. I'm trying to be brief.
So, excuse me, a minute right before we move to the next, I would like to ask, how do you think can advocacy work in mental health be improved?
May I ask you to repeat? I'm sorry.
How do you think advocacy work in mental health can be improved?
Okay, how do I think it could be improved? I'm already very grateful and admirative of everything that has been done. I think it was said by one of the previous speakers that the system that has been built in 28 years is very, a lot have been done. So rather than saying what could be improved, maybe I would say what we can add. I do believe that a lot of information needs to be provided to the people at the youngest age possible. I'm so happy that RBC is working through schools. So this type of initiative should be strengthened. And I don't know, TV programs everywhere. I think we should talk about mental health everywhere. Advocacy should be everywhere. Everywhere there's a human, there's a health questions. There's no health without mental health, so that's where advocacy should happen. We should all be advocates. And I'll stop there.
Thank you very much.
Going forward, I would like to ask Professor Sezibera, as you are part of the UR teaching staff and you are the director of Center for Mental Health, would you kindly tell us what is your work as the Center for Mental Health? I will ask you two simultaneous questions and you'll answer them briefly. So what is the work of CMH, and is mental health being considered in students' welfare here in the campus?
Thank you. Thank you, moderator. The question, I think my answer is simple. It's simple. As a staff, as a teaching staff, I do teach, but you are interested in knowing what we do as the Center for Mental Health. One, I have to thank my university to have created the center. This center was created only in 2015. And the main purpose was to bring together all the colleagues who are, these are some of the activities. If you want me to summarize, we do research, training, partnership with other institutions to include UGHE. Thank you for festival, Hamwe Festival, and what we do known as Mugirandumva, which is a community mobilization and education. And also, thank you, moderator.
I will ask you, now you were talking as the director of CMH. So in the perspective that the theme of our panel today is ensuring availability and accessibility of mental health services in the youth, me as a student of the University of Rwanda, I know that there is a high demand rate in terms of schoolwork, in terms of extracurricular activities. So what is the university providing, or what services is the university providing to ensure that there is a good mental health status of the students in the campus?
Yeah, thank you. I think on our campuses, there are already some services that are offered. We might see some differences when you move from one campus to the other. What we have in Huye might be different from what we have here and Rukara and other campuses, but they are services within the Directorate of Students Welfare. What we as the center we want also to do, and thank you all the student association to have been active in this campaign, is also to equip and strengthen the student association because we believe that by also equipping your associations, we build capacity. You use a language that is accessible to your peers. You can change in the attitude vis-a-vis mental health needs. We minimize in stigma. We raise awareness, but we share also the information where to go and seek help. So we think by strengthening and equipping the staff working in those units, but also equipping students' initiatives, we build the capacity, but also we improve in our university community well-being. So we are playing the two role, equipping those who are working in students' welfare departments on our different campuses, but also to invest in those different youth associations so that they can also contribute in that psychoeducation and promote health.
Thank you.
Thank you a lot. And now I would like to address to Basilia May. Would you please kindly tell us briefly about yourself and your work?
Good afternoon. Anyway, I would like everybody to be active for this. My name is Rosamaza Maiva Basilia. I haven't started university yet, and I am the founder of Here to Share. Well, you can say that I am a bad example for basically sitting beside leaders without a degree, but all it takes is a great mind. So Here to Share is a non-governmental and non-profit organization that helps people dealing with mental health issues for free and anonymously as a person wish. And for the more friendly version, I would say that Here to Share is a team of people who have dealt with mental health issues and who are also dealing with it, me included, that are willing to help anyone else struggling to not fight their battles alone. Yes, thank you.
Thank you so much about the insight. My next question is, having lived with mental health difficulties, what was the process of accessing support and care?
Yeah, so first of all, for a person living with mental health issues, it is very, very hard to express yourself. Why? You always feel like you're different from others, okay? That's the first thing. You're like, what I am feeling is not right, so for that reason, I have to fix it for myself. So you learn how to hide it, you learn how to communicate, you learn how to laugh without laughing, you learn how to express yourself in ways people won't doubt a single thing you say. So it was very hard. It was very hard because, I won't lie, I had to cry alone many nights. I had to hide my thoughts. I had to act with my family, my brother, my sisters. It was very hard until one day, it was more than I can handle. So I was with my mother. I told her that I haven't been feeling good. So let me tell you guys, I was surprised. I was surprised to see someone so understanding. You really need that person in your lives. I was I felt like she wasn't judging me. She actually asked me, what is it that you feel and what is it that you need? At that moment, I told her everything. I told her that I've been dealing with depression. Well, I had made my own researches about depression because I was so confused, you know, why am I feeling this way? I started by feeling like, am I sick? Is this a disease? Do I need to go to see a doctor? Do I need pills? So on and so forth. So I told her I have depression, and since 2016, and I was telling her that in 2019. So yeah, that was kind of a distance since I was alone. So after I told her that, she said, I have a doctor for you. I have a doctor at Indira. She was amazing. She's a nun, yes. We talked. And don't be like, nun, you know, Catholic and everything. You can't tell her this, you can't tell her that. No, she was open-minded. She let me speak. So for some reason, I didn't feel connected to her. And I kept feeling like it is me. The problem is me. I have to learn how to open up. And yeah, they gave me pills, antidepressants. I took them. They were to be taken for a month. I only took them for 1 week. And then I don't know what happened. Something just clicked, and I took them all. Yes, I did. So after taking them, I don't know, like I came back to thinking, called my mom, told her I took all the pills. What do I do? She freaked out, she panicked, I'm losing my little girl and everything. She took me to Faisal, King Faisal, Kachiru, and yeah, they took care of me, spent the night there, had to throw up everything. It was really painful, guys. Don't try taking a lot of pills. It's a really big pain. So I met with Dr. Chantal. She works at CHUK, and she said, come see me. So I did. I went there. The first session, we talked. Guys, that was my second mother. We really talked. She listened every word I said. She paid attention. And that's when I realized that all it takes is a person ready to hear you for you to heal. That's why we started Here to Share. That's why I started Here to Share. And all my team, they know how important that is, how important it is to have someone who listens to you. We don't take any problem, it's a small problem, it's a big problem. No, if you cut your nails in the wrong angle, we won't judge you, we will help you fix that, we will get you a manicure, a pedicure, whatever you want. We are here, and we are here to listen, we are here to help. And we also share. What do we share? You might ask, it's not money because, as I told you, it's for free. But we share our experiences. It's not always depression, it's anxieties, it's ADHD, it's OCD. Even OCD can be a really big problem since you have to arrange everything. So we share how we dealt with that. We talk about it. We have a group that Mugwaneza Bruce, my cousin also, he started that group. It's called The Neurotics. A group of people who have dealt with mental health issues. So we talk about it. We talk about it as an open subject. We discuss ways how to communicate with someone, where can you get help, how much it is, what can you use if it's insured, everything. So Here to Share, what we personally take care of is the anonymity. We believe that we don't need your name, we don't need your age, we don't need where you work to help you. Just if you want us to call you a cat, we will call you a cat. The information you give us is the information we use, because there is no rush. There is no rush to explain yourself. Tell us what you're ready to tell us, and when the time comes, you will tell us more, or even not. Maybe you get better the first session or not. Yeah. And free, again, I'm coming back to the free subject. Why is it free? Well, I believe that one shouldn't pay for one's mental well-being, because it wasn't a choice. depression is not a choice, anxieties are not a choice, ADHD is not a choice. It's just the way a person is. And if I'm able to help that, if I'm able to fix that, I shouldn't put a price on it. I should put all my courage, all my energy into it. Thank you.
Thank you, Mayava, for such a speech. I would like to ask Dr. Jean-Pierre Ndagijimana, you being the co-founder of Rwanda Psychology Society, and you have worked in trauma and community healing for the past 10 years in different settings here in Rwanda and in the United States. So briefly tell us about your work. Tell us your work, you yourself, and what you have been doing in helping people access mental health services.
Thank you so much. My work both in Rwanda and in the United States has been around leveraging Rwandan but also African cultural ways of healing, ways of knowing and doing to address the unique issues that our countries and the communities face. In the United States, in the last 5 years, I was a part of the University of San Francisco, working directly with students. And currently, I'm also working in Berkeley, in the Bay Area, California, with supporting African diaspora. So I work with African communities under an organization called Partnerships for Trauma Recovery. And here I have different initiatives, including Ubuwiheranwa, which is basically with the understanding that it is until we work with the people with experiential knowledge and work with them to co-generate the knowledge and the practices that are culturally responsive and contextually relevant to their lives and their cultures, that they will engage. As you say, I have been in this work and I got great mentors. Some of them, I'm honored to be here with them, is that many people disengage or do not want to come forward and seek support, mainly because, maybe, because there are some barriers, but they know how to work around those barriers to get help. So the work I've been doing, both in practice but also research, is how can we meet the people where they are? If we are speaking about engaging youth, they are probably the experts, and maybe I may remove that probably. They are the experts of their lives. So when we talk about the people, the service users, the people with experiential knowledge, if we can center them and co-generate and not just institutionalize the theories and the practices of, I will give you examples of with the Ubuwiheranwa community I've been working with. They have been talking about kwistressura. They have been talking about kwibebeza. When I look at it through my work in California, I see some connections. But if I take the same context of the work I'm doing in California and do the same thing here, people do not want to engage. There are some concepts about mental health, whether it is disorders, whether it is a framework of interventions. If I bring it to my mom or my uncle or my neighbor, they will like, what is it? But what if I work with them directly to hear how do they call this thing? And can we develop programs that they feel that, This is what I experience, that if we bring that knowledge from the community and co-generate with them those services, it's until when we bring it back to them and say, is this you? Is this what you need? And when they say, oh yeah, it feels like you know who I am. So this is the work I've been doing, both through research and practice. Thank you.
I've heard that you try to meet people where they are and provide good services for them, and they find a place where they can correlate with different situations. So you being a mental health practitioner for over the years, I would like you to tell us what is the accessibility rate, or what are the successful developments in mental health practices that are responding to youth mental health status?
Thank you. With my work, again, my work focuses as an educator. My background is in education, public health, and psychology, and I combine all of those in my work. I've seen what kind of seemed to work and what hasn't seemed to work. And if I can focus on what has seemed to work, but also what I've been learning from other people, including initiatives like these. One thing I have learned is that, as a colleague here said it, there is that feeling of wanting to hide from others. The people, the community, is a source of support, but it also can be a source of harm when they don't know how to care to someone who is emotionally vulnerable. Many people, from my research and work, they want help, but as long as no one will ever know that they are seeking help, can you help me, and no one ever know, even not only the story, but not knowing that I'm even seeking help. So that's something that has seemed like, okay, this is a way to go. That's something I've been also developing in that way. Other things, I have also seen initiatives like the community, the student-led. As I say, student-led, my interests are mostly around community-driven. People with experiential knowledge being acknowledged and as the experts of their own lives. So when initiatives like those, I see like these student-led initiatives, because they know the most, they know the best strategies that can meet them where they are. So initiatives such as those that are community-driven, of course, we can have scholars be there for support and funders, supporting those initiatives. And I see those like those student-led organizations, what they are doing. Another thing I've been observing are those initiatives that are not necessarily called mental health, but are very therapeutic in their own nature. What I want to say here is that an intervention does not need to be therapeutic. Does not to be called therapy, does not to have a label therapy on it to be therapeutic. So there are initiatives that are not called therapy, but have therapeutic effect. I've seen initiatives that are combining issues around financial vulnerabilities and emotional vulnerabilities. And knowing that, it's until that for those people, let's talk as we speak about youth. If someone is not having access to school fees, is not having access to basic needs, let me use that word. And then you come and say like, okay, I want to address your emotional well-being. In many times, they find it as like, this is an insult. So what if I work with them? I have seen also some initiatives, but also in my own work I've been working. I'll give you an example in a high school. I work with through my, one of my graduate study and master's program. but also in my doctoral program. I did the research in a high school. And what I was there doing was, okay, who are the people who needs healing resources? They came. And what I did with them was, let's discuss the problem, but also discuss solutions. And we worked together to develop resources. You know what they did? They developed a rabbit and a chicken projects to address the emotional well-being. That is not how I was taught in my Western models. I'm sorry to use that but my approach is a decolonial way, if I can be a little unapologetic. So when we hear that community trying to see, like, if we use, for us, korora inkoko, raising chicken, korora rabbit, nibwo buryo tuzabonamo amagi ku nkoko, we will sell eggs, and we will be able to buy pens. That is a framework for some communities, and in other contexts where I work in the US, that may not be the best option. But when I was working on that project in the western province of Rwanda, that is what they co-generated. So that is what I mean by meeting the people where they are, but working with them as the experts of their own knowledge, of their own lives, but also making sure you are available for them. You are guiding the process in whatever that means, but not influencing that too much, but you are there when they need you. But you're also making sure that funding, that they go to those initiatives as well. Yeah, thank you.
Thank you, Dr. Jean-Pierre. Cutting it short or wrapping up the session, I would like to invite each panelist to kindly give us a call to action. What are you recommending the students to do? What are you commending the stakeholders present here to do? A call to action for each panelist.
What I would recommend would be a bit of what I said before. Everywhere there is someone, there is a health discussion that could happen. And in that discussion, there could be a mental health discussion. So everywhere we go, I think that providing information or just talking about mental health could make tremendous gains in terms of reducing stigma, making people feel very comfortable to reach help if one time they need it, or if they already need it at that time. So that would be my recommendation.
Thank you. For everyone here, my first advice, and I say advice, is to not be afraid to try to communicate. I'm not telling you to go on and tell someone, hey, I have depression, or hey, I have anxieties. No, just start small. I've been feeling kind of low. Things have been bothering me, and then see how that person reacts. So, and go on, go forth, go telling them. And another thing is be open-minded, because you might not have those mental health issues, but maybe your friend does, and they don't know how to tell you. So let them feel free around you. Be a safe space for them. Thank you.
Thank you. If you are feeling lonely, if you are stressed out, I know it is hard to seek help. I mean, from our personal experiences as well. If we can be honest, we are stressed out in different occasions and have so much experiences that each individual is dealing with. And from a personal level, I know that it is very hard to seek help. And I do also know that the healing is really hard. It's almost requires a full-time, it's kind of like a full-time job when your heart is deeply in a darkness. But it is worth the effort. So I will encourage you, if you or a family member or someone else around you try to find at least one person you can trust. And if you can find one person you can trust, and if you can be lucky that that person there's going to be a mutual interaction, which has also seen being more effective here in our culture, that person is important. Tell them just a little as can say even hi when you are hiding. Just being hiding from the community. I know that when we feel how we are feeling, we don't want to see other people. At least call that person, ask them to meet up and maybe share a milk or just sit outside. I like the Imbuga space, the car-free zone. I think that has been one of the most spaces I feel like it's going to be helpful. And then institutionally, for institutions, I really encourage that institutions support the community-driven, the people with experiential knowledge, with the experiences that we are trying to heal. Please support them financially, but also with the mentorship. And the same with the academic institutions, I would say to do research on that, but also having more of spaces like this, but also opening it to the communities. Having more communities from outside, having university and community engagement. And I hope that with that collaboration, and building on also wonderful existing efforts such as those being developed by Center for Mental Health and collaborators, I think we are in the right direction. Thank you.
Yeah, thank you. I want to cut it short to save any time, but I have 4 things to say. One, I send a call to my fellow youth here present. I think I'm not Musaza. My fellow youth, don't hesitate to seek help when you need it. There is no need to feel shamed when you are sad, when you are anxious. Seek help. It is normal. My second message is to continue requesting partners here present. I'm seeing UNICEF, RBC, FXB, Rwanda, Boston College, and many others to continue investing in child and adolescent mental health. The few studies we have in Rwanda are mostly about adults. Services, many of them, not all, are adults oriented. Even the training at the university here, we have a few that are child-centered. So I will send that call to invest in child and adolescents' mental health. Let me say the last one. I thank RBC, UNICEF to have supported us. UNICEF, come and come again and come again. I can keep saying come again. It will be our pleasure working with you on these different aspects I was just mentioning, and of course, RBC supporting all our initiatives and others. So thank you. I want to save time. I'll stop there.
Thank you, everyone, especially the panel members, for the beautiful discussion we had. And I would like to wrap up this session by saying that we should not be afraid of asking help whenever we feel like we need help. There are so many associations here to help youth, such as me and my colleague there, so we should not totally be afraid. Thank you very much for the beautiful discussion again, and we hope we will meet next time. Thank you.
Thank you so much to the panelists. I think they deserve another hand of applause, please. Cutting it short, it just reminded me of the theme of today. I hope we didn't talk about it so much. The theme of today says mental health in an unequal or an equal world. It means a world without discrimination. Either you're part of the rainbow, which means either you're gay, you're a homophobe, or you're not a homophobe, you're straight, you're not straight, whoever you are, whatever race you're coming from, this matters to you too, whoever you are. Coming to this break, I would like to ask the youth. There is something I thought about. Everybody is using nowadays something said, right? Or everything happens through the mind. Or let's put it in French, tout se passe dans la tête. Which means, however we are as human beings, whatever we use while thinking, while walking, if the brain is damaged, you cannot at all do it. Whatever you are doing as a service, helping one another, you can't even recognize your family member if you have a certain problem in your mental part or your brain. So this came to me as Albina personally, and I would like to share this story with you. Recently, they opened up bars and clubs and all, like we are having this good time, even if it's still the COVID situation. But I met one of my friends, and I was like, why are you getting so drunk? Why are you taking a lot of smokes? Why are you really taking a lot of things they call drugs and all? So she told me, you know what? It is what it is. So it means using the word, it is what it is. That person wants to cover whatever issue she has or he has. So I ended up going at her place, and then I saw the quarrels at her home. She has a mother, a person called mother, a biological mother, but then the mother doesn't treat her well, even if it's the right mother for her. So it means those are the issues that happen on a daily basis. So coming to that, I have this small quote that I would like to share with you. The strongest people are those people who win battles that we can see. So it means whatever battle you're going through, even if you can see it and you're winning it, then you're a winner. And then we should share love, prepare to help one another as the panelists told us. Wrapping it up, we have videos that are coming along. Wrapping it up, before we watch some videos, while waiting to watch the videos, the poems, and even the music from our guest called Ariel Wise, we have our guest of honor, Dr. Kaite Shonga Yvonne. Please may we welcome her for a speech. With a hand of applause, please. Is she around yet? Yes.
Hello, everyone. It's my pleasure to be here with you today. This is a big day for me, for my colleagues in RBC, especially in the mental health division. As my colleague, Dr. Darius said, Rwanda presents a high burden of mental illnesses, especially in the youth. According to different studies, the contributing factors include traumatic events, traumatic experiences during the genocide, but also domestic violence, poverty, etc. In Rwanda, the access to mental health care remains very low. It's as low as 28%. Over the last 27 years, Rwanda has invested a lot in creating services, in availing community-based services, in developing highest available and equitable mental health services. And to address the treatment gap, there is a need for programs, there is a need for activities that educate people about mental health, to raise the awareness around mental health in general, and encourage people to seek mental health when they are in need. The health sector policy, the 5-year RBC strategic plan, 2020-2024, were designed to specifically address stigma and improve mental health service utilization. We therefore call upon all our partners to embark with us on this journey and support the government's efforts in the decentralization of mental health services at community level through community health workers, but also local NGOs. We are calling everybody to implement prevention and early mental health interventions programs for children and their families. We wish everybody created specific programs including adolescent mental health and school-based mental health programs. We want you join our effort to strengthen community-based mental health promotion and prevention. We are putting effort in continuing mental health outreach activities to increase awareness in the general population. We conduct a sustained, comprehensive national mental health anti-stigma campaign to improve community attitudes and understanding of mental health and services. It's my pleasure today to say that we are grateful for the initiative in research, in training and clinic in UR. I am sure, dear colleagues, teachers here in the University of Rwanda, that through your attitudes, you are taking good care of yourself. When I say taking good care of yourself, I mean you are taking care of your good mental health. You are taking care of your students so that you are preventing yourself and them, your students, your colleagues from suffering from mental illnesses. You are doing a great job in normalizing mental health because this is key when it comes to build resilience, when it comes to ensure well-being. Normalizing is a really good advice because of all stigma surrounding mental health. We appreciate your initiative to organize this mental health campaign. Let's work hand in hand to make sure that this campaign and more is an opportunity to mitigate the stigma around mental disorders and increase the number of persons who seek mental health services. I urge you to conduct further researches and secondary analysis of existing data in order to keep updating Rwanda and the world on the mental health status of Rwanda. Not only that, policymakers need findings. Policymakers need data so that they have a knowledge of the magnitude of mental disorders, of mental health problems. They have a good knowledge of every facet of mental health for a country. So we will be relying on your work to make sure we are serving the population in a good way. Thank you, UNICEF and the UR family. Thank you, the College of Medicine. I thank very much the Center for Mental Health under the leadership of Professor Vincent. I would like also to thank every organization that is working in the field of mental health, all you from various organizations who took part of the organization of this campaign and beyond. Because of the nature of mental health, because all the barriers we are discussing, we are still discussing here, preventing people from seeking care, we will need to keep this momentum. We go beyond the campaign, we keep educating the population. I can say that we are lucky to be at this level of understanding of mental health issues. So let's be the activists, let's fight against stigma. I'm sure we will be contributing to the good mental health of the Rwandan population, but also all friends of Rwanda and the world. So, once again, the Ministry of Health leadership was not able to be here due to other assignments. If you follow the media, you may be aware of what is going on in Rwanda. In this difficult time, we are fighting against a COVID pandemic, but this is not saying that mental health is not a priority. The Ministry of Health, RBC, will be already all the time there to join hand with you to promote good mental health for our population. By saying that, I thank you very much and wishing you well.
Thank you so much, Government Rwanda Representative Dr. Kayiteshonga Yvonne. while wrapping it up, I think it's a good time that we are reaching in much more Liz and Ease time. We are about to listen a beautiful poem from Miss Amanda Akaliza Lorette, a poem called Imfura Heritage Rwanda. And afterwards, we'll be showing you guys a beautiful video for all the testimonies that we put together about this event of Mental Health Day. And of course, afterwards, we'll be having a beautiful queen talking about the mental issues through her songs. That's Ariel Ways. Let me ask you to not really go out because it's about to be so exciting. While we're coming, Akaliza for the poem. Akaliza Lorette, please. She's not around? Okay, for wrapping with time, let's watch the videos immediately so that we can catch with time. Thank you.
Sezibera ni umwarimu muri kaminuza y'u Rwanda, nkaba n'umushakashatsi cyane cyane mu birebana n'ubuzima bwo mu mutwe. Nibyo nigisha, nibyo nkora no hanze ya kaminuza, ibikorwa byanjye biba biganisha aho ngaho. Ni byiza cyane kuba turi no kuganira turi mu kwezi kwa 10. Mu kwezi kwa 10 duhereye ku itariki 10 z'ukwezi kwa 10 ni igihe kiba cyarahariwe kwita no kuganira ku birebana n'ubuzima bwo mu mutwe ku rwego rw'isi ndetse natwe mu Rwanda. Uyu mwaka ni na byiza ko urubyiruko bigenda bigaragara ko ruri mu bagiye basigara inyuma mu kwitabwaho ku birebana n'ubuzima bwo mu mutwe. Ubusumbane bugaragara, hakunze kugaragara ko urubyiruko na serivisi zigenerwa abakiri bato ntabwo ziteye imbere. Ariko ikindi kinashimishije mu gihugu cyacu, umwaka ushize hatangiye gahunda irebana n'ubuzima bwo mu mutwe mu mashuri. Aho ngaho niho umuntu yanahera avuga ko hakenewe ubufasha mu mashuri, abantu bakorana n'abarezi kuko babisobanukiwe, yaba ari cyane cyane psychologists bakorera mu mashuri, bityo bajye babona hakiri kare umwana ukeneye ubufasha, ahabwa ubufasha, ndetse banagira inama abarezi n'ababyeyi uburyo buboneye bwafasha umwana waba ugaragaza ikibazo. Kuko hari ubwo abarezi n'ababyeyi bashobora kwitwara ku buryo buhungabanya, bukomeretsa umwana, batazi ko barimo bamuhungabanya, bamukomeretse, kuko batazi. Ku bana kumenya ukeneye ubufasha, ariko anatoza abarezi n'ababyeyi uburyo bwunganira bunuzuza bwatuma umwana arushaho kumererwa neza.
Njye nitwa Dr. Jean Damascene Iyamuremye, nkaba nkora muri RBC, ari cyo kigo nyarwanda gishinzwe ubuzima. Nkaba ndi umuyobozi ushinzwe imivurire y'indwara zo mu mutwe ndetse no guteza imbere serivisi zihabwa abafite ibibazo byo mu mutwe. Kugeza hafi 20% gusa ku ijana nibo babona ubufasha, cyangwa se nibo begera serivisi ziriho. Impamvu ni iyi, nuko benshi batinya kugaragaza ko bafite ikibazo cyo mu mutwe. Abenshi nta nubwo bazi ko ikibazo cyo mu mutwe gishobora gufashwa nk'izindi ndwara. Hari abatari bemera ko ubuvuzi bugezweho bita ngo ni ubuvuzi bwa kizungu budashobora, nuko mbere yuko baza kwivuza babanza kunyura ahandi. Bamwe banyura mu bapfumu kuko abapfumu baracyahari, hanyuma abandi bakabatinza babasengera, nubwo wenda gusenga tutabikerensa, ariko mu by'ukuri batinda mu nzira. Hanyuma bakagera ku mavuriro batinze pari konseka bakavurwa bikerewe, noneho ugasanga abantu baritiranya ngo uburwayi bwo mu mutwe ngo ntabwo buvurwa ngo bukira. Ariko kimwe mu gituma abantu batagira icyizere nuko bivuza batinze. Ubu rero ni umwanya duhawe kugira ngo tubarangire ko serivisi zihari, hanyuma bivuze hakiri kare, hanyuma noneho basubire mu buzima nk'abandi bose. Uburwayi bwo mu mutwe bwaba bukwiye gufatwa n'indwara kimwe n'izindi, ziravurwa zigakira, hanyuma noneho umuntu agasubira mu buzima busanzwe.
Nitwa Haragirimana Claver, ndi umuyobozi w'umuryango nyarwanda uhuriyemo abantu bafite amateka ku buzima bwo mu mutwe cyangwa se banyuze mu bibazo by'ubuzima bwo mu mutwe. Akato abantu bakunze gukora batanabizi, ashaka kwicara akavuga ati narwaje, cara hano nkugaburire nkuhambike nk'ibyo. Umurwayi avuga ati nkeneye kujya gusenga toya.
Twese nk'abanyarwanda cyane cyane urubyiruko, nubona mugenzi wawe yarengereye mwibutse wirengera kugira ngo atangiza n'ubwonko. Ari igihe wangiza ubwonko ntunamenye inzira utahamo. Cyane cyane njya mbona urenga urugo rw'iwanyu, njya mbona urenga mu rugo ukikomereza.
Sinyamarenga actually uvuze ibintu byo mu rugo uranyibutsa. Mu rugo ni hano hepfo, naga ari hano hepfo nakubwiye.
Kimironko?
No, mu Gitega.
Mu Gitega
urahazi?
Mu Gitega hazi Nyamirambo.
Ubwo ufite telefone ya kabiri, ya mbere barayibye rero. Okay, ariko
definitely
hari iwacu hari ndahakunda cyane kuko haranyinspira, niho na brage nyinshi zanjye nzikura. Ariko wari uzi ko ntabwo ari mu Gitega gusa, imijyi myinshi yo muri Kigali uzi ko kaburimbo n'indi bitandukanye imirenge.
Burya
niko bimeze.
Did you know?
Uri kuzamuka Kimisagara, uriya muhanda wa kaburimbo ujya Nyamirambo no mu Nyakabanda, hakurya ni muri Kimisagara, ino ni muri Gitega. Abantu bahagiye barabizi.
Ndava hano njya kureba ibyo bintu.
Noneho imihanda y'amabuye itandukanye utugari.
Kandi koko kwa Rujugiro na Rebero
ntago ari umuhanda w'amabuye,
ni umuhanda w'amabuye.
Sibyo nkubwira. Noneho imidugudu buriye itandukanwa na za ruhurura. Na za ruhurura,
urugero
ugasanga iyi niba ari ruhurura.
Aba batuye he? Ni Nyakabanda.
Uyu ugasanga wenda ahangane mu Kabeza, ahangane muri Mpazi. Niba ari akagari niba kabaho. Noneho aho ngo biranoroha cyane kubera yuko usanga umwenda wawanitse ukagwa hakurya, ntago bakubwira ati umwenda ugoye kwa Rusini. Bavuga ati wa mwenda wagoye mu kagari ka Kabeza.
Ari uzajya kukura.
Kubera ukuntu Kigali yegeranye cyane, ari nko mu cyaro wakumva akagari ka Kabeza ukumva ibirometero. Noneho ingo z'abantu muri azitandukanywa n'amagambo. Hamwe n'ibiryo bateka. Buriya hari ukuntu bamubizi ko kwa Karenzi saa 7 z'amanywa inyama ziba zihumuye. Mubizi ko kwa Rusine saa 7
abantu bose bakunda kuhasura. Ahantu haba inyama. Everybody likes meat. I'm telling you.
Mubizi neza yuko kwa Rusine saa 7 z'amanywa nta muntu n'umwe uri mu rugo. Twese tuba twagiye kwa Karenzi. Bazanyama.
Coming back to the theme of today, mental health in a unique world, it means go share some love. Use your Instagram to share some love. Hashtag self-love, hashtag self-care. Ariko numara kubivuga, or after writing that, remind that person that you love them. Njenga Jerusine, uze kureba muri chat yawe, nakwandikiyemo ko ngukunda. Wabibonye?
Ndahira.
Wabibonye?
Sinababwiye bya bintu byo gusinda. Wari wasinze? Okay, actually I love you too.
Definitely share some love. That is ko turi muri situation ya COVID, kwirinda kugera umuntu kutagira gute. Ariko nimba ubyutse mu gitondo, gira umuntu hamagara umubaze utese waramukanya amahoro. Utese amarahoro yahe? Amahoro yo mu Rwanda cyangwa amahoro y'u Rwanda. Nimba ari mu Rwanda. Nimba ari hanze y'u Rwanda, koresha ururimi rw'amahanga umubaze uti umeze gute. Reba umuntu mubana mu nzu ushobora gusanga wa muntu umukoresha nk'umufasha mu rugo, umukozi adafite amahoro bitewe n'ubuzima yaciyemo. Mwegera umuganirize kuko hari ikintu nkunda cy'abagide. Abagide bakunda kuvuga ngo turi mu isi mbi ariko tufite inshingano yo kuyisiga ari nziza kurusha uko yari iri.
Right.
We are in a damaged world, but we have the mission to leave it so beautiful than we found it.
Yeah.
That's the idea.
Actually, abanyarwanda nicyo kintu uvuze cyo gukundana ni ikintu cyiza cyane. Apart from yuko abanyarwanda bakundana, buriya abanyarwanda no kugira ngo ube mu Rwanda ni uko uzi kubaka. Construction ikintu cy'ingenzi. Murebe u Rwanda nko mu myaka 20 ishize uburyo rimaze gutera imbere. Uburyo inyubako zubatswe, imihanda yubatswe, ubona ko kubaka ari ikintu cyacu kandi byanatangiye kera kuko murabizi yuko umuyobozi mwiza abafite ibitekerezo byubaka
cyane.
Urumva harimo kakajambo ko kubaka. Businessman mwiza ngagomba ngo kuba ari ku rwego rushimishije kandi urwego akenshi rwifashisha he mu kubaka. N'urubyiruko natwe twese turi ahangaha iyo barimo baratubwira ngo nitwe imbaraga z'igihugu kandi zubaka.
Hari umuntu bivuze ari inyuma ni mumuha amashyi nubwo tutamubonye. By the way, let's acknowledge that we have Miss Amanda.
Amanda Akariza Amanda.
Give her a round of applause because she's doing a good job here in Rwanda.
Yes.
And of course, we are wrapping it time by telling you that we are about to give certificates for the Gaining Game and Health on Mental Health Award. And it will be given by our dearest honor of guests. And of course, afterwards, we will be having a beautiful, exciting time with our airways. Let's welcome Rulinda and Nadej.
The floor is yours.
Thank you.
Thank you so much. My name is Kwizera Rulinda. I'm a clinical psychologist to be, and I'm among the organizer of Gaining Game competition on Mental Health Award. So here is.
Thank you very much. Good afternoon again. By the names of Nadej Nema, and we are organizing team of Gaining Game. It was planned for mental health awareness, especially among youth. We are lucky that all those that attended the game mostly were youth. They did 12 hours open online exam and 102 got shortlisted. Among those 102, with the help of experts from Center of Mental Health, they managed to help us and come up with 5 winners. That's why we are here today, to reward our first winners and look upon other youth who can attend in Gaining Game next year. With all due respect, I would like to call upon the guest of honor that we are here with today. I will start by Sugira Muryango. There are 2. There are Jean-Marie Vianney with Arsul. They could come and help us.
As they are coming forward, we are going to request the best contestants, who is Samuel Ndaisenga from Busogo. He can come in front. And Kaitesi Brenda from Lucy's.
Brenda and Samuel.
Clap hands
Round
for
of
them.
applause. They are first winners, the 5th and the 4th. Brenda on the 5th and Samuel on the 4th.
So Samuel is from Crop Science and Kaitesi Brenda is from Department of Finance. As they are bringing the rewards, certificates, those are the 2.
The 5th, Brenda. She's being rewarded by Jean-Marie Vianney from Sugira Muryango. They're giving them the perfect certificate of what they worked for. And they're also giving them a white envelope with a red letter inside. The fourth is Samuel.
Samuel Ndaisenga.
He's being rewarded by Miss Also. She's also from Sugira Muryango. A perfect t-shirt. He's also getting his certificate
Of appreciation.
and a white envelope with a lead letter inside. Thank you very much from Sugira Muryango.
Before they go, they can put their t-shirts and
Yeah,
receive the bags.
wear your flag. You worked for it. We would also like to call upon Professor Sibera Vincent, Director of Center of Mental Health. He's going to help us reward. He's going to help us reward the third runner-up, whom we call the second runner-up here. He's called Mans Patrick from Wusogo. When is second runner-up? Yes, sure.
So we are going to welcome the second runner-up, who is Mukundi Kuri Amisa from the Department of Government and Leadership at Huye. She's welcome. She's going to be awarded by Professor Vincent Sesbel. So,
Okay, she's here. She can come in front and receive her reward. There she is in black. She's the first runner-up. She's also going to receive her t-shirt that mentions second runner-up of Gaining Game. She's also receiving a certificate along with the white envelope with a lot of red letters inside. Thank you very much.
so we are going to call upon the first runner-up, who is called Manzi Patrick. I think he can come across here, and he's going to be to be awarded by UNICEF representative.
Thank you very much, Vincent. Professor Nossa, he's going to help us and reward the first runner-up of Gaining Game. He's also receiving his t-shirt along with the certificate and a white envelope with lead letters inside.
Wow.
Thank you very much for helping us.
For the winner, I'm excited. I'm so excited. I'm calling the representative of RBC Mental Health Division to take a step forward and give a reward to the winner, Dr. Kaite Songa. Yvonne, she's welcome.
Round of applause for her, please. She's going to help us and reward our winner, who is a girl. She really worked hard and have the highest marks. That's why she's the winner. And her name is?
None other than nayigira umubyeyi Claudette.
Round of applause, please.
Round of applause.
There she is.
She is a clinical psychologist to be.
Round of applause, please, for her.
At UR campus.
She's going to be rewarded
By Dr. Kaite Shonga Yvonne.
in neat, unique color, which is gray, for gaining game winner. There she goes. Her certificate. Of gaining game winner, along with a white envelope. Let them take the picture. With white. On top of that, she's going to be receiving an award of fast gaining game winner.
Big prize.
Big prize for it. Round of applause for
Round of
it.
applause.
There
Round
she
of
goes.
applause, please.
Thank you very much for helping us. Thank you very much. I really look forward for other youth to participate in Gaining Game next year. That is going to be happening each year. Thank you very much.
Thank you very much. I need to notice something about the gaining game. The results from the question that has been asked is going to be published via our website and even Twitter handles. Thank you so much.
Thank you.
Another round of applause to the gaming team. Twongere twikomereze muri cya kinyarwanda. N'ubundi nibyo byabyo. N'ubundi turacyari kuri World Mental Health Day celebration. Ndagira ngo mbabwire ukuntu umuntu ashobora kuba afite ubuzima bwiza bwo mu mutwe akabasha twabyita nko kwidebriya nubwo yaba afite ubushobozi bukeya ariko akabaho kandi akabaho neza. Hari umutipe umwe twiganye muri segonderi yari afite ishati imwe, one shirt and one t-shirt, imwe gusa kabisa, kuko twarambaraga kuva kwa mbere kugeza kwa gatatu. Ubwo numva n'ama t-shirt twajyaga tuyambara sometimes, ariko akuntu muri kaminuza arahari, no muri kaminuza numva yari ahari, ntago namuvuga ngo yitwa Rusine. Ariko ninjye reka mbivuge gutyo, ni ngewe nyitangira kaminuza nari mfite ishati imwe na t-shirt imwe, abyambara icyumweru cyose nta na kimwe nsubiyemo, kandi icyumweru kigashira, ishati imwe na t-shirt imwe, icyumweru kigashira. Kuwa mbere nambaraga ishati nkafunga ibipesu agutya, kuwa kabiri nkambara t-shirt yonyine, ishati nkayisiga muri hosteli, kuwa gatatu nkambara t-shirt, nkambara n'ishati ariko nkayidegaja, ibipesu nkabifungura. Kuwa kane nkambara ishati harenzaho t-shirt inyuma hakagaragara ikora ry'ishati gusa. Kuwa gatanu nkambara t-shirt, urubyiruko rwo rurabizi, hari ibintu byitwa royo byo gufata ishati ukayifunga hano hasi. Kuwa gatandatu nkasiba, icyumweru nkafura. Kuwa mbere nkongera nkambara gutya. Albina, where are you? Here is your mic. What do I use?
Here I am. Thank you so much, Rusine. Thank you, everybody, for being patient. I think now is the right time to listen to the message Ariel Ways kept in her song. The song was out in 2020, and it was about what happened to her life. This is her personal life. And she sang it in a beautiful song that you'll be about to listen. So let's stay attentive. Thank you so much. Ariel Ways, the floor is yours. A hand of applause, please. Woo, woo, woo. Inzira. Ways on the way. Hello, guys. I'm very happy to be here today. I'm very happy to be here today on the World Mental Health Day. And this means a lot for me because I've experienced depression. And here's a song for anyone who's going through this. Thank you. Yeah, yeah. Yeah. Whoa. Night and days, fighting the devil in her head. Nobody knew how hard it is for her. It comes on so fast. How long will this last? My heart is just pounding, my head started spinning. Please go away, she does not want you in. Oh yeah. Agahinda no kwigunga nibyo bimuranga. Agahinda no kwigunga nibyo bimuranga. She just needs you and me to give love and affection. She just needs you and me to tell her it's gonna be alright. Oh, nobody knows, hey, nobody knows. She's fighting the devil in her head. Oh, nobody knows, yeah, nobody knows, yeah. She's fighting the devil in her head. You think I'm doing nothing, but I'm doing my best to keep my busy mind to rest. Breathe, calm down, hey, that's what they say to me. Na umenya gahinda kundi, nivuga kumbabara muzanyumve. Agahinda no kwigunga nibyo bimuranga. Agahinda no kwigunga nibyo bimuranga. She just needs you and me, hey, to tell her it's gonna be alright. She just needs you and me to tell her it's gonna be alright. Oh, nobody knows, eh, nobody knows, eh. She's fighting the devil in her head. Oh, nobody knows, eh, nobody knows, yeah. I'm fighting the devil in my head, hey. I choose to accept myself just as I am. I'm fighting so hard to fight the devils in my head. Feelings, thoughts, always around me. I don't know what to do right now. Yeah. I wish this voice could scream enough how tired I am. Tired of this sentence, tired of dissension. I'm so done with being chained by what you think I should be, chained by what you think I should wear, chained by who you want to see in me. I'm a person, not a problem. I'm neither a woman of humanity nor a man of my humanity. I am a fusion of both. I am a fusion of both. Say, you dream a fancy word, well, I dream a freedom word. You choose to follow your detest, but I choose to follow my ways, my ways, my ways, my ways. My ways is what I see. She just needs you and me to give love and affection. She just needs you and me to tell her it's gonna be alright. Nobody knew it was hard for me. Oh, nobody knows. I wish you could listen to me. Oh. Thank you so much. Thank you. DJ, let's go. I want to see you guys have some fun today. So, who want to jump with me? Who want to dance with me? No one? Okay. It's okay. Hey. In crazy life, I go down for you. Hey. Big time love I have for you. Hey. Tiempo na vida sangre, oh mi amor. Let's go. Hey. Oui, ton amour c'est ma vie. Hey. Et mon devoir c'est la vie. Hey. I need you like medicine. Yeah, yeah, yeah. Oh, oh. Hey. Abandika tira jana nanje. Nilo kitu za vikora kwa joya. Nije vibration muri nation. Hey. Stand up. Umutima urakwiyumvira. Waiza saho ndabikubwira. Nkurikira nkwereka inzira. Gira, baby. Ichikubabaza. Gira. Hey, I love the way I'm living. La vida loca. 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 Oh, say. La 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 la. La 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 la. Umagutuza, yeah. Tenda gukunda, yeah. Ways on the way, that's how I go. Wind up on me, I like those trouble. Run on my beat and I won't mind it. Oh, abandika tira jana nanje. Nilo kitu za vikora kwa joya. Ninja vibration muri nation. Money, me don't know. Body, would you hold me for too long? My nigga spirit's only way up. Tryna have fun, don't disappear. Si changanyi na manafiki. Siendani na wafitina. Sio kwa ubaya. I love the way I'm living, la vida loca. Oh, yeah. La vida loca. La vida loca. Oh yeah, oh yeah, oh yeah, oh yeah, oh yeah. La vida loca. Bébé, l'amour c'est ma vie. Bébé, l'amour c'est ma vie. Bébé, l'amour c'est ma vie. Oh, only body would you find. Only body would you find. Only body would you find. I love the way I'm living, la vida loca. Yeah, say, la vida loca. La vida loca. La vida loca. La vida loca. Thank you. Thank you. Who wants to hear away? Away. Who wants away? Let's go. Yeah. Stand up. Let's go. Ways on the way. Hey. Baby, when I look at you right there, hey, you
make me warm enough and I feel like home. Yeah, yeah. You know when I see how you love me, I can do anything just to prove you that my fancy it go away, away. Would you go away with me? Away, away. All time I had these things now I don't know. Hey, sinshaka kugenda ni wowe utumanuza, wowe utumanunda. Ibyo ubonera yeah. Sinzi uko washinuye n'ibicu nkomera ku byo twasezeranye. I don't know why, oh I don't know why. Now ukuntu ndeba you want me, yeah. Undi kutabeshya you love me. But tell me how I will never ever go for your love, baby. I just stand for your love. I'm gonna walk through your way for this love. We got to run the city for that love. Hey, you will take me away. Will you let me take you so far away? Away, away. Every time you on there, you're my
Organizing team mube mwigira imbere. Organizing team mube mwigira imbere dusoza.
In our time of breaking up and make up routine, I don't know why sinakuja kure. Go for the time, maybe you know how many pictures I reject for you. You know I gave you my heart, please give me yours. Ruth quit to go, I can never deceive ya. Oh yeah, I'm always late for my baby. Since you go and sleep, you will get true.
Your process, yeah, I don't know why. Oh, I don't know why.
Now do you know? Let's go, let's go, Kigali Rwanda.
Let's go, Kigali Rwanda. Ariel Ways, let's go.
For your love, baby. I just stay for your love.
Organizing team meeting imbere.
For this love. We got to run the city for that love.
Tell them to Ariel Ways, go get it, go get it. 1, 2, 3, go. Away, away,
away. Will you let me take you so far away? Away.
Organizing team mwijere imbere tujina.
Away. Thank you so much. Murakoze cyane.
Thank you so much, Ariel. Organizing team mwijere imbere dusoza. Organizing team. Yeah. Ndabizi ko ibyishimo ari byose, ndabizi ko ibyishimo.
Abadufashije ko ino event.
Yego.
Badufashe begera imbere tubashimire tunasoza ariko ntabwo birangiye. Hari exhibition iri hano hanze.
Yego, hari exhibition cyangwa se ibyateguwe mu buryo bwo mwarebesha amaso.
Yego.
Hanyuma hari no gusangira. Gusabana.
Rimwe nakubwiye ko kwa Karenzi tutajya dusiba saa.
Bya bindi Rusina akunda.
Organizing team twegera imbere.
Organizing team twihute ducunguze uburyo umwete. Hari uburyo ngiye kukwigisha gushimira Rusine. Njya mbona utazi gushimira. Fatira mikoro gutya. Abantu twese twicaye muri audience muri bumfashe muhagurutse ariko kuko iki ni gikorwa ntekereza ko kizaba ngaruka mwaka ariko kirenze kandi kirenze cyane. Mu buryo tugiye kubikora tugiye gukora gutya dukoma amashyi muramfasha turakora mu ra ko ze murakoze. Twagiye twese, let's try it. 1, 2, 3 go. Mu Ra. Ko. Ze. Murakoze. None ibyo bintu turabikora duhagaze. Duhagarare mwese muri aho ngaho. Let's stand up and thank them so much. Mbere yuko dusoza reka duhe ijambo Professeur ari hano inyuma atubwira ijambo ryo gusoza twita dukora ako kageste naberetse mwese. Abantu bari inyuma muhagarare tubahe icyubahiro. Iki ni igikorwa cyiza badukoreye nk'urubyiruko nk'igihugu ndetse no ku isi hose. Professor, this is your floor.
Murakoze, mwiriwe. Nta kindi ndi burenzeho kuri iryo jambo uretse kubabwira ngo murakoze, muri beza, tukomerezaho kubera izihe mpamvu. Ibyo turi kuganiraho ibirebana n'ubuzima bwo mu mutwe nabyo biri mu bigize ubuzima. Icya kabiri, imbaraga twese dufite hano nk'urubyiruko nta cyatunanira. Za association zagize uruhare muri ibi bikorwa tukomerezaho. This is not an end. No, it was just a start or even a continuation y'ibihari. Turababwira ko the Center for Mental Health, the College of Medicine, the University of Rwanda, colleagues who came from African Leadership University, the Adventist University, UGH, and others, and you guys from UR, you are very exceptional and unique. Tukomeze izo mbaraga, dukomeze dukorane, hanyuma ubuzima bwo mu mutwe nka wa wundi wavugaga niba abantu bazi malaria bakaba nazi igitera malaria bakabyirinda n'uwarwaye akamenya aho yajya kwivuriza, we can do the same in mental health, and that's what we want to do. Sibyo? Rero nanjye muntize amashi mbashimire. Tuzabatumira ubutaha a très bientôt nk'uko tuvuga mu Gifaransa. Oh, thank you, my very exceptional moderators. Where is the other man? Ari ubu wakangahe Patrick mu ishuri?
Abo twigana biga mu wa gatatu.
Wowe
nanjye niga mu wa gatatu clinical psychology.
Wabaye wakangahe?
Haryo harimo ibintu by'imyanyara. Gusa amanota yanjye iyo ndi kuyareba
Okay.
Oya.
Nuwa mbere mu banyuma cyangwa hagati.
Bafite imbere ariko yinyuma mu buryo
mushimire Patrick. Patrick ni umuhanga. Albina, welcome again. Iyi team tubita izina. This is a winning team. Mubashimire cyane. Hari abaraye bageze hano saa 5 z'ijoro hafi saa 6 bavuye gutanga ikiganiro muri campus ya Nyagatare. Abandi bari bavuye muri campus ya Rusizi. Abandi baraye hano barimo bategura ibingibi. Munguriza andi mashini zayabishyura. Nibo ndi kureba protocol na hari n'undi musore uzasaza kiri muto kubera kwitanga cyane. Where is Joseph? Joe ari. Hari umusore witwa Joseph. Tumushimire ndaza kumushyira amashimwe amuhaye. Hari abandi mubona bambaye bakanagira bo n'imidari mu ijosi. Protocol. Babandi bagendaga n'abasaza nkanjye bakancumbagiza nkagera mu nawe mubashimire. Thank you guys. hari wa mukobwa mwiza wari umaze kudususurutsa yatashye wazampa Imana ikantiza akabaraga nkabyara umukobwa nkuriya ntabwo byaba ari byiza byaba ari byiza yes naze come Ariel. Yes, and your team, of course. Can I just do this and say thank you very much? You made this group, I don't know, what do you want to say to them?
I want to thank you for giving me this opportunity.
Thank you for accepting the invitation.
Yeah, and it feels good to talk about something that happens to you that connects with other people's story. So it's always a privilege to be here.
Yeah, I was saying if I could be able again to have kids, and God bless me to have a kid and a daughter like you, I'll be very blessed. So I'm blessed through you. Thank you very much. Thank you, and come again when we invite you. Come and talk to this very promising youth of us. So thank you very much. We will invite you again. I hope you will say yes. Thank you. Okay, that's the end of my word. If you forget each and everything, don't forget that I'm very passionate about mental health, that I feel blessed, that I feel proud, that I'm also encouraging you guys to keep working for mental health education, promotion, and psychosocial support. God bless you all.
Thank you so much.
By thanking whatever we did, you guys, everybody who is in front, even people who are outside, the journalists, the media, everybody who is here, let's give them a hand of applause. Since 1, 2, 3, go. Mu. Ra. Ko. Ze. Murakoze. Blessings to everybody. We have an exhibition outside if you want to see the good work of these people. If you want to have something to eat, we will be sharing, talking to each other. Let's go. Blessings to everybody. This is up.
Cause you light up the fire upon me. Love poison for me, yeah. Look what you've done to me. Icha tupangese na nomwangizukuri. Bangoma mukomanga, bangoma mukomanga. Icha tupangese na nomwangizukuri. Na nonyibira kabanga, na nonyibira kabanga. I'm ready to die for you. Distract all the swines for you. Caterpillar, my right or die. Ready to die for you. Distract all the swines for you. Oh, you go say, my right or die. Actually, we walk caterpillar. Actually, we walk caterpillar. I don't wanna check. I don't wanna check. I kavumo kanje akira basi ubanza umfasha akagakota tujyane kure cyane nubwo bidunda ariko ngera volume reka umuriro ugere mu gihumbi ubana ngiye gukora family. What the hell does it going on? Baby, you know that you the one for me. Caterpillar magic, I'ma keep it stormy. If you're not cozy, baby, I'm sorry, babe. Oh yeah, you come hold me, babe. Baby, you know that you the one for me. Caterpillar magic, I'ma keep it stormy. If you're not cozy, baby, I'm sorry, babe. Oh yeah, come hold me, babe. Icha tu pangese, na no mwangi zukuri. Angoma mukomanga, angoma mukomanga. Icha tu pangese, na no mwangi zukuri. Na no nyibira kabanga, na no nyibira kabanga. I'm ready to die for you. Distract all the swines for you, caterpillar. Alright, all die. Ready to die for you. Distract all the swines for you. Oh, we go say. Alright, all die. Bubba Pro on the mix.
Country record.
Izuba ritishe kazinga toboye sinjirota ngeze home batiri nkayicajinga uyu munsi ndadisturbinga abaneighbor banje ntihagira ugira ubwoba kurusaku muri bumbe samoya ndabona icome telefone samoya urasanga nikotine Vite saucisson, vite banana, urakore choice upata icyo ushaka. Vite saucisson, vite banana, urakore choice upata icyo ushaka. Nawe ndakuzi umukobwa wo mu mujyi, uzi gare n'amanuka uranyonga. Oh baby samoya, mu rugo samoya, yewe nawe samoya, mu rugo samoya. Oh baby samoya, igeze mu rugo samoya. Kandeke kukwica muri mind Imerera ndekera hola nyendogo bushagarira I respect you madam Uzengu ibyawe hey, nyuma ya saa moya urabusa n'uwakoze massage uyu munsi ndadisturbing abaneighbor banje ntihagira ugira ubwoba kugasaku ndibuteze kumoninga kwawe kutachinga kwawe position zawe zinanzongoira Vite cassava, vite cucumber urakora choice upata icyo ushaka Vite cucumber, vite cassava urakora choice upata icyo ushaka Sinkubipanda gukerereza meze nka ritipi izamuka shyorongi Oh baby samoya mu rugo samoya yewe nawe samoya mu rugo samoya Oh baby samoya igeze mu rugo samoya ireke tubonane samoya Make beat on the beat. Yeah. I could be instructor, I could be your guide, I could be the leader. We go to the Kumurongo. I could be your vodka in the Hari Daily. You don't have to worry, girl, I'm looking for your lover. I could be instructor, I could be your guide, I could be the leader. We go to the Kumurongo. I could be your vodka in the Hari Daily. You don't have to worry, girl, I'm looking for your lover. Don't even think about it, I've been there before. I wanna give you license to take over the city. KGL Menyeko, you coming for the money. Take it easy, don't complicate it. Be fat and simple, mommy. Take time, don't rush it. Girl, you know me, the movie control it. So whenever you like, we can stay up till the morning. Sweet lover, you're the only one. Pick up the phone, use the hands, sweet lover. I wanna look at you, baby Kidogo, Katerina. Say whatever you say, she's my new lover. I deserve her. I wanna look at you, baby Kidogo, Katerina. Hey, say whatever you say, she's my new lover. I deserve her. I could be instructor, I could be your guide, I could be the leader. We go to Kumurongo. I could be your vodka in the Hari Daily. You don't have to worry, girl, I'm looking for your lover. These things I see you've been doing, I like it, baby, how you moving. You don't know you can do it yourself. They can when they can be calling myself. Mommy, yo, I think about showing you to mama. Baby, you the movie, you can stay for longer. Putting on me how you did the moody weekend. Call me anytime you can come over. Take it easy, don't complicate it. Be fat and simple, mommy. Take time, don't rush it. Girl, you know me, the movie control it. So whenever you like, we can stay up till the morning. Sweet lover, you're the only one. Pick up the phone, use the hands, sweet lover. I wanna look at you, baby Kidogo, Katerina. Say whatever you say, she's my new lover. I deserve her. I wanna look at you, baby Kidogo, Katerina. Hey, say whatever you say, she's my new lover. I deserve her. I deserve her. I deserve her. I wanna look at you, baby Kidogo, Katerina. Oh, baby, girl, say whatever you say, she's my new lover. I deserve her. Oh, baby, girl, I wanna look at you, baby Kidogo, Katerina. Hey, oh, baby, girl, say whatever you say, she's my new lover. I deserve her. Oh, baby, Katerina. Oh, baby, Katerina. Oh, baby, Katerina. Oh, baby, Katerina. Oh, look at you, baby, Kidogo. Baby, baby, stop. Take it easy. When you leave, I swear I can't breathe. Do you really care, baby? Even wonder your promesa. You are my fantasy, my only desire. Kukutekereza nijoro bituma nasinzira. 'Cause you make me fall in love, darling, darling. If you touch me one more time, I might lose my mind. Baby, it's too much here. Can we go slowly? 'Cause I can't take it. 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 Give me your attention. 'Cause you got my affection. Baby, baby, and so good to taste ya. Took you now step by step on the beat. Put your night hand in hand in the street. Getting by. Sing it. You are my fantasy, my only desire. Kukutekereza nijoro bituma nasinzira. 'Cause you make me fall in love, darling, darling. If you touch me one more time, I might lose my mind. Baby, it's too much here. Can we go slowly? 'Cause I can't take it. 'Cause I can't take it. 'Cause I can't take it. Mama, way, yo, yeah. Easy way, yo. Cause I can't take it. 'Cause I can't take it. 'Cause I can't take it. 'Cause I can't take it. Oh, slowly, slowly. Ooh, yeah. 'Cause I can't take it.
Like the moon in the sky, girl, you light up my life. Nakindi nasabi manuretse kuku kumana iruhande rwanyu. Yora wisekera, nukababare ma. Let me fix you tonight. Let's love each other till the morning light. Let me put together all your broken pieces. I hear your heart talking, babe, I'm here to listen. Oh, I'm here to listen. Oh, you need umwanya, ngwino ngukunde, ni wowe nari ntegereje, oh darling. Without you, I'm a dead man. We're meant to be together, now and forever, baby. Bang, bang, this love is on fire, on fire, yeah. This love is on fire, yeah. murikira inyenyeri zirusha kwaka tuzimya amatara asigara urumuri utanga urumuri utanga maze ibe neza neza nibisendera umutima girl ntiwifate ubisangize. Let me put together all your broken pieces. I hear your heart talking, babe, I'm here to listen. Oh, I'm here to listen, yeah. Oh, you need umwanya, ngwino mukunde, ni wowe nari ntegereje, oh darling. Without you, I'm a dead man. We're meant to be together. Now and forever, baby. Bang, bang, this love is on fire. On fire. Yeah. This love is on fire. On fire. Yeah. Oh, mama. Lose yourself and then park hard. Reach yourself, I'll give you extra. Yeah. We'll go on and on and on and on. Cause this love is on fire. On fire. Yeah. This love is on fire. On fire. Yeah.
At the top, body on the floor, to the left, to the right, You're the baddest. Everything you do to me, you drive me crazy. You're so perfect. Let me tell you something, baby flex. Baby dance. Life is too short, relax. Give me a kiss now. Find in Miami, Johnny Mombasa. Find in Mombasa, to tie hit you got it. Mama, yo. When you turn around, when you turn me on, girl. The way you whine and charm my roll. When you turn around, when you turn me on, girl. Go down low, when you go down low. Go down low, when you go down low. Don't you hurt your mouth. You over when you're honey. When you leave me alone, you're stuck in my head. Take it to my jacuzzi, give it to you till you lose it. Come my holly, holly, babe. Tell me when you're ready. At the top, on the floor. To the left, to the right. Find in Miami, Johnny Mombasa. Find in Mombasa, to tie hit you got it. Mama, yo. When you turn around, when you turn me on, girl. The way you whine and charm my roll. When you turn around, when you turn me on, girl. The way you whine and charm my roll. To the left, to the right. Give me a kiss now. At the top, on the floor. To the left, to the right.
Bubble Prong the beat.
I know you like it when I touch your body. You say, be my baby, and I say yes. Oh, baby, come closer. Isi bayenoya. See the way you move. That guarguama. I know love when I see it. I can tell when I feel it. I go tell your daddy. I go tell your mommy. Don't be a stranger, babe. Like you don't know me. Baby, doesn't matter. I know you can feel it. Give me a love. I'm waiting now. Como kunda, babe. Niruzashira. Give me everything. Give me everything. Give me everything. Give me everything.
I know you love it. When I kiss your butt, you say, baby, don't stop. Baby, don't stop. Come so what I want to membabara. Usi say na babara. I know love when I say it. I can tell when I feel it. I go tell you, I go tell you, mama.
Can be a stranger, babe. Like you don't know me. Baby, doesn't matter. I know you can feel it. Give me a love. I'm waiting now. Como kunda, babe. Niruzashira. Give me everything. Give me everything. Give me everything. Give me everything.
Skibbity bum bum bum.
Oh, na, na, na.
Skibbity bum bum bum.
Oh, na, na, na.
Skibbity bum bum bum. Skibbity bum, skibbity bum, skibbity
Don't
bum
be a
bum.
stranger, babe. Like you don't know me. Baby, doesn't matter. I know you can feel it. Give me a love. I'm waiting now. Como kunda, babe. Niruzashira. Give me everything. Give me everything. Give me everything. Give me everything.
Skibbity bum bum bum.
Oh, na, na, na.
Skibbity bum bum bum.
Oh, na, na, na.
Skibbity bum bum bum.
Oh, na, na, na.
Skibbity bum, skibbity bum, skibbity bum bum. Skibbity bum bum bum.
Oh, na, na, na.
Skibbity bum bum bum.
Oh, na, na, na.
Skibbity bum bum bum.
Oh, na, na, na.
Skibbity bum, skibbity bum, skibbity bum bum.
Uziko ngukunda. Baby, you know better. Uwo nifuza. Guhora ndeba.
Tumepanda milima tukashuka mabonde, wawili kwa mapenzi, 'cause I love you. Uzamjalila bana, uzamjalila bana.
Baby, I go extra miles. Would you come with me? Ndagukunda sibanga. Nyamikazi w'i Rwanda. My African darling. Sinigeze nkwanga. Sibyo.
uzambyarira abana, uzambyarira abana.
Baby, I go extra miles. Would you come with me? Ndagukunda sibanga,
uzaba nafuye,
mwamikazi w'i Rwanda,
waache watuzime,
my African darling,
utakafasi nzuri,
sinikize nkwanga, sibyo.
Monster Records.
There goes my baby, my baby. There's no other like my baby. So let me talk to you before bedtime. Yeah, let me whisper something sweet, sweet, babe. I'm better, better, better when I'm close to you. I'm better, feeling better, yeah. 'Cause when you dance, when you smile, everything you do stays in my mind. You too fine, you too fine, you too hot, you too hot. Gatting on the kino sanga, I lose control. You make me lose control. I lose control. You make me lose control. I woke up on your side. Oh, how I like you. I don't wanna turn around, baby, 'cause now when I look at my baby, I need is a mama. That's a mama. Ukira mabanga yanjye yose, yose. 'Cause I'm better, iyo ndi kumwe nawe. I'm better with you. 'Cause when you dance, when you smile, beauty in and out. You take my breath away. Oh, this way. Tu es si belle, t'es la plus belle. Every day you look new, I love what you see. Love of my life, you are my fantasy, girl. Tu es si belle, signora. Vraiment si belle, signora. Tu es si belle, I drink like a bell and remind you, oh my signora. Ni oe munda, mevugana ni soni. Isoni, oyanta ni soni. Isoni, oyanta ni soni. Spectacular, ukusa baby. Ni kusa baby, particular, ukuri baby. Ni kowori baby. From the way you talk to the way you walk, you blow me away. The way you care, ukusa baby. Oh, this way. Tu es si belle, t'es la plus belle. Every day you look new, I love what you see. Love of my life, you are my fantasy. Tu es si belle, signora. Vraiment si belle, signora. Tu es si belle, I drink like a bell and remind you, oh my signora. Ni oe munda, mevugana ni soni. Isoni, oyanta ni soni. Isoni, oyanta ni soni. Giza buda shiriro na table, musana viche si belle. Mon amour si belle, si belle, si belle. Tu es si belle, signora. Vraiment si belle, signora. Tu es si belle, I drink like a bell and remind you, oh my signora. Ni oe si belle, si belle, si belle. Si belle, si belle, si belle, si belle. Si belle, si belle. Bébé comme t'es belle, oh t'es si belle. Bébé comme t'es belle, comme t'es belle, comme t'es belle. Bébé comme t'es belle, oh t'es si belle. Oh yeah. Umenipatia vyako Loki nikakupa vyangu Rika rika nidusha kabivanga Kuko mabel Ibanga mu kinyarwanda Ni ry'ababiri Oh t'inquiète pas Qu'on s'arrête pas Baby t'inquiète pas Qu'on s'arrête pas Soyons sages bébé sois sûr Que nous sommes low-key Mapenzi yetu utamu Eva na Adamu Njemba numva turi muri Eden Ba Eva mbe Adamu Ni wowe madamu Asa get in and I get out Low-key, low-key, low-key Ooh, Papa, mama, shut down Low-key, 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 low-key Get nawe, tukundane Low-key, low-key, low-key Ushajua wate Low-key, low-key, low-key Low-key, wewe Like Rocky Balboa Low-key, mama Nipata buku mukarago Cause low-key is key Take your whiskey, leave them With that shitty fight Now every day barkusa nawe Nawe Barkwifanga uwa poe Poe Oh, t'inquiète pas Qu'on s'arrête pas s'arrête pas, qu'on s'arrête pas. Soyons sages, bébé, sois sûr que nous sommes low-key. Mapenzi yetu tamu, Eva na Adamu, nyemba numva turi muri Eden. Ba Eva mbe Adamu, wowe madamu. Asa get in and I get out. Low-key, low-key, low-key. Ooh, papa, mama, shut down. Low-key, 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 low-key. Get nawe, tukundane. Low-key, low-key, low-key. Tushajua wate. Low-key, low-key, low-key. Low-key, low-key. Like Rocky, Madabo. Low-key, mama is key. Nipa tabu kumukarago. Asa get in and I get out. Low-key, low-key, low-key. Ooh, papa, mama, shut down. Low-key, 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 low-key. Get nawe, tukundane. Low-key, low-key, low-key. Tushajua wate. Low-key, low-key, low-key. Low-key. Like Butterball. Okay. Low-key. Butterball. Low-key. Low-key.
Estava tão tristonho quando ela apareceu. Seus olhos que fascinam logo me estremeceu. Os meus amigos falam que eu sou demais, mas é somente ela que me satisfaz. É somente ela que me satisfaz. É somente ela que me satisfaz. Você só colheu o que você plantou. Por isso que eles falam que eu sou sonhador. E digo que ela significa pra mim. Ela é o morango aqui do Nordeste. Tu sabes, não existe só cabra da peste. Apesar de colher as batatas da terra, com essa mulher eu vou até pra guerra. É amor. É somente ela que me satisfaz. É somente ela que me satisfaz. Você só colheu o que você plantou.